All right, so my name is Andriana, and I'm speaking to you today from the ancestral homelands of the Solo Nation. Today, I'll be presenting some of the points from my culminating report, which assessed barriers that impacted recovery for survivors of sexual assault within the context of Abbotsford, BC. Many of the barriers I found and the recommendations I made span outside of the context of Abbotsford, so I want to take the opportunity to share some of these things that might be impactful to your community or province as well. Before I begin, I would like to take a moment to address that the content covered discusses sexual assault. I encourage everybody to put their well-being first. Please feel free to take a break or revisit this presentation once it is posted online. I'd like to start by thanking my practicum organization, the No Society, and my wonderful supervisor, Riley, for all the support I received. It was a great experience getting to work alongside so many inspiring and driven individuals. I would also like to thank my professors who have assisted me along the way throughout my entire program and who have been a great support through my practicum and culminating report process. I'd also like to send a special thank you to my friends and family who have been extremely supportive throughout all of my academic endeavors. So I did my practicum at a charity in the Fraser Valley called the No Society. They provide support to survivors. They provide support through resources, information sharing, and by providing access to education that supports survivors in their recovery. The organization has gone through a period of change that I was privileged to be a part of, in which they tailored their approach to meet survivors where they're at and provide enhanced support during unprecedented times. And I'm sure everybody's sick of hearing the term unprecedented, but I truly couldn't think of a better word to describe what we went through together. In the Valley, we were not only impacted by COVID-19, but by the floods as well. The strength of this organization and the people who work within it is truly inspiring. Today, I will be sharing some of the highlights from one of my projects I worked on during my practicum term with the No Society. Survivors frequently experience negative impacts on their physical, psychological, emotional, and sexual health. My culminating project explored barriers that negatively impact the ability for a survivor to recover within the context of Abbotsford, BC. I also discuss overarching themes that exist within the greater context of both BC and Canada. I made recommendations to provide insights as to how survivors can be better supported and how societal norms can shift. I want to acknowledge that recovery may look different for each survivor, so I intentionally do not define what recovery is. I only address barriers and make recommendations to improve support during the recovery process. In Canada, it is estimated that 1 in 3 women and 1 in 8 men have experienced sexual assault. Belonging to the 2S LGBTQ+ community, having a disability, identifying as a gender other than male, being an Indigenous woman, age, and immigration status have been shown to increase this risk. In the Abbotsford and Mission region specifically, self-reported data from 2018 found that 22% of individuals over the age of 15 experienced sexual assault or unwanted sexual behavior. These statistics, although current, are likely not accurate. It is estimated that only 1 in 10 occurrences of sexual assault are reported. Sexual assault can impact social, emotional, psychological, physical, and sexual health of survivors, either temporarily or chronically. Trauma has been seen to perpetuate negative health outcomes among survivors. As well, negative experience within formalized support, such as police or healthcare, have also been shown to perpetuate stigma and re-traumatizing survivors, leading to worse health outcomes. 2 themes were consistent throughout the literature: stigma and underreporting. Stigma and underreporting have been seen to negatively impact the recovery of survivors across all supports available within the context of Canada, British Columbia, and Abbotsford. These 2 trends here, they tie closely together, but they were quite consistent throughout all of the literature. Stigma plays a role throughout the entire process of a survivor's recovery. Stigma ranges from, at an individual level, internalization, to, at a structural level, societal norms. Stigma in all of its forms creates barriers for a survivor to disclose to either their personal support system or formal support systems, which create barriers to receiving services. Stigma may also be present in negative reporting experiences or negative experiences when accessing services, perpetuating the stigma around sexual assault and creating more harm for the survivor. When looking at primary prevention as well, stigma also creates barriers to methods such as education, which is very important when we look at shifting societal norms and combating misinformation around sexual assault. It is estimated that, again, 1 in 10 sexual assaults are reported to police. Stigma also plays a role in underreporting, as it is most commonly found that feelings of shame, self-blame, or concern for anticipatory stigma prevent disclosure. Non-disclosure creates barriers for survivors to receive services and support in their recovery. Underreporting also creates challenges around budgeting and allocating the appropriate resources that support survivors and investigate perpetrators. In my culminating report, I categorized the services available into the 6 categories that you see here. The types of services I categorized were healthcare, counseling and emotional support, legal services, crisis support, connection with other services, and safe housing. Separating the services into these categories helped me to understand what barriers and limitations exist and helped to guide my recommendations. Wait times, cost, and education were some of the biggest barriers and limitations that I found. This was observed within Abbotsford and within the greater context of both BC and Canada. Wait times for counseling and healthcare services is an ongoing problem observed throughout the country. This makes it difficult for survivors to access timely care. In terms of cost, counseling and other mental health supports are often not covered by provincial health plans or by employer benefits. The cost of these services makes them unobtainable for many individuals, including survivors, which creates a large barrier in the recovery process. I also want to note that there are some low cost or no cost options, but due to the situation currently, it's quite a long wait list to get to access them, which ties into the first barrier. Education is also a primary prevention method, but can also be used to assist in creating supportive environments for survivor recovery. Misinformation, stereotypes, and stigma could all be influenced by education. In Abbotsford specifically, public schools have an abstinence-focused approach to sexual health education. This approach eliminates the opportunity for education to be utilized as a primary prevention tool. The current approach in Abbotsford is shown to be ineffective at delaying sexual activity and perpetuates the stigma surrounding sexual health and sexuality. So the 4 recommendations you see here are 4 of the recommendations I had in my culminating report. I have a couple more, but I wanted to share these 4 with you folks today. So as I said before, education can be used to provide a supportive recovery experience and as a tool for primary prevention. Starting in grade school, it is important that all individuals have access to unbiased information around sexual health, consent, and healthy relationships. In addition, it is important that information is guided in fact and does not use stereotypes or misinformation that perpetuates stigma around sexual health, sexuality, or sexual assault. It is important that school districts review their policies around sexual health education to ensure it is reflective of these points. Moving on to the next recommendation, negative reporting experiences with law enforcement and healthcare providers reinforce trauma and perpetuate stigma among survivors, creating barriers in the recovery process. Analyzing, changing, and implementing policies as needed to ensure survivors have supportive experiences when accessing services will address a large barrier and help destigmatize receiving services. Within the context of Abbotsford, there is not a lot of publicly available information around tracking whether negative reporting experiences occur, or if they do occur, what happens next. Understanding the scope of this issue is the first step in creating positive change. Alongside creating supportive experiences, it is important that formal systems have policies, procedures, and practices that are reflective of this goal. In addition, it is crucial that they are adhered to and updated as necessary. Transparency and accountability are integral throughout this entire process. Formalized support systems need to be transparent and accountable to the members working within them, to survivors, and to the general public. I place advocacy as the last recommendation, as all of the previous recommendations require support from advocacy. The organizations and stakeholders involved will change whether we are advocating for updated public school sexual health education or advocating for transparent processes that record negative reporting experiences. However, the more advocacy that is done and the more that this is discussed, the greater the impact will be. Every conversation and every action taken helps to combat stigma and support survivors in their recovery. I would like to move on to questions now, if any folks have them. Thank you so much for listening to my presentation today. And I do understand this is a lot to digest, so feel free to use the chat, ask a question, or I'd be more than happy to connect offline as well.